DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show today. Our guest is Dr. Dan Loy. We're going to talk about liver abscesses, cattle feeding, and much more. Stay tuned and enjoy the show.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson and we're here at Iowa State University where I'm joined by a friend and colleague, Dr. Dan Loy. And Dr. Loy is a professor of ruminant nutrition, growth physiology, feedlot, cattle, and also the director of the Iowa Beef Center here at Iowa State University in the Department of Animal Science. And it's good to get you here.
It's good to be here.
It's Dr. Loy is one of those that has had patience with me at times, and, but also been somebody that's encouraged me throughout my career, and very thankful for all that you've done. And let's talk about liver abscesses, because it's something we deal with and battle all the time.
Yeah, so liver abscesses are kind of a constant factor in the feed yard industry. They're actually a symptom of various other potential problems that are out there. But you know, one thing that people don't talk a lot about, we talk about the negative effect on performance and cost of production, but livers are valuable. I mean, they're part of the value of the carcass, and when they get condemned, that decreases the value of the carcass and affects the whole value chain.
Yeah, and you know, I was reading that, you know, roughly, 18% of the livers have liver abscesses, and that's a pretty big chunk, and that can fluctuate a lot.
That can fluctuate a lot. I think there's some regional differences. There are some you know, you see between 10 and 20% where they've been for some time. There's also some differences on the type of cattle that we're seeing some particular issues with some of the dairy crosses right now.
Yeah. And so why do we get a liver abscess?
Well, liver abscesses are kind of a secondary factor that happens after a drop in rumen pH.
Okay.
And so you know, we usually define acidosis as something below a pH of 5 or subacute acidosis less than 5.5, but it's really not. I mean, normal healthy cattle, their pH may drop below 5, but it's the period of time they're below 5 and how rapidly it drops below 5. And after a period of time, that low pH eats away at the rumen wall and makes it susceptible to specific bacteria that parks itself in the liver and can cause liver abscesses.
Yeah, and I think that what you need to know, regardless of where you're at in the digestive tract, everything flows to the liver.
Everything flows to the liver, and I think you told me it's the same microorganism that causes foot rot. Is that correct?
It is. Foot rot, calf diphtheria, and liver abscesses, Fusobacterium
Fusobacterium,
causes it. So it's obviously in the manure,
right?
Which we know how the manure gets there from going through the digestive tract. So cattle carry it worldwide. It's a huge issue.
Right. So it's in the environment, and the conditions have to be right for it to find its way through the portal vein to the liver.
Yep. And then you start to think about things like during the winter when we start to get some mud carriage, and cattle love to groom themselves and each other. And so they start nibbling on that. That's not mud, right?
Right.
And they start helping groom each other, and it just continuous cycle.
And yeah, exactly.
Yeah. So we're going to take a break. When we come back with Dr. Loy, we're going to talk about some of the things that liver abscesses can do to performance, potentially health, carcass, and how to prevent them here in the show. Glad to have you here. Glad that you're watching. We'll be right back.
Nasalgen 3 is a new 3-way intranasal BRD vaccine that offers young calves unrivaled protection against devastating respiratory diseases, including IBR, BRSV, and PI3. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose new Nasalgen 3 PMH, the first and only 5-way intranasal vaccine on the market. Talk to your veterinarian and visit nasalgen.com to learn more.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Dan Loy. We're in Kildee Hall where we're shooting this here on the campus of Iowa State University, where Dr. Loy and I both serve as faculty members. Dr. Loy is a professor of ruminant nutrition and growth physiology, and he is the director of the Iowa Beef Center. And if you want to know who has the thumb on the pulse of the beef industry in the state of Iowa and surrounding regions, it's this guy right here. And pleased to have you. Let's talk a little bit about, because liver abscesses, not one size fits all. There's different types, right?
Yeah, there's a scoring system. An A, A minus, A, and A plus, that just goes from severity. So if you see just a few abscesses, that might be an A or an A minus. But if you get large, severe abscesses, that would be considered an A plus score.
Yeah, and I am almost sure that veterinarians came up with this scoring system because it's letters with pluses and minuses, and they never intended running statistics on any of it. Okay, yeah. Instead of having 1, 2, 3,
right?
Here we go. Right.
Exactly.
But yeah, you're right. That when you see an A minus, it's a little bitty one. Mm-hmm. A is bigger ones and more prevalent, but those A pluses are FUBAR.
Right. Right, exactly.
As we increase in severity, is there a difference in the impact that the liver abscesses have?
Yes, well, yeah, I guess the first thing I'd say is that even the lower scores, the less severe ones, are likely to be condemned at the packing plant.
Oh, yeah.
So that's a value. But the real problem are the A pluses. Those are the ones that severely reduce performance in the feedlot. On one study we did, we saw carcass weights as much as 50 pounds less. And so that's a significant negative impact on cost of production, performance, and enough to make it a real economic issue especially if you get into that 20, 30, and occasionally we'll have pens that are 50, 70% liver abscesses, and that's a real negative effect.
Huge.
Yeah.
Yeah, and then I'm gonna guess if you have lighter carcasses, it probably winds up being more detrimental to quality grade.
Yeah, negative effects on quality grade as well. Interestingly, if you look at what causes, when we talked about that, what causes liver abscesses, it usually means that you have a little lower pH. It means you're probably feeding a little hotter ration. And so those kind of intermediate or low scores, and some studies actually have better performance because it's correlated to the types of diets that they're being fed.
Diets and intake.
And intake, exactly.
And so we get the intake, we get the lower pHs, and here we go. As we look across the continuum, you know, we talked about beef on dairy cross calves having a little higher prevalence of the, but they can also have more severity too.
Yes, there's, you know, of course there's a lot of variation there. You know, some pens on beef on dairy that have minimum, but if you just look at the overall statistics, they tend to be higher, and on those really severe cases, a lot of times it's from those particular pens. A lot of reasons that have been implicated or talked about for that. One's the way they're fed, having higher grain diets throughout their life. There's been some that would suggest that they do a little more grooming among each other that may
some bad habits
be implicated as well.
Yeah, and I just loved when Orskov noted that sheep did not get liver abscesses, and he fed cattle hair to sheep, and they got liver abscesses.
Yeah.
And so we've tried to replicate some of that in the winter with longer hair coats and grooming, but haven't got it to work. But there's something potentially there. When we come back, we're going to talk with Dr. Loy about some of the things we can do management-wise to prevent liver abscesses. You're watching DocTalk, and we're glad you joined us.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dan Loy. We're at Iowa State University, and Dr. Loy is a professor of ruminant nutrition. He is the director of the Iowa Beef Center and a mentor for me in my career, and we even did similar research in our graduate school days, and so I got very involved in reading your literature before I ever got a chance to meet you. But when we talk about liver abscesses and prevention, you know, we automatically go, I heard one person tell me, well, you don't see liver abscesses in a cow out on the pasture. And so, but I have seen liver abscess wrecks on some really rich grass in New Zealand. So it can happen, but at the end of the day, we're really talking about grain and roughage.
Right. Yeah, and so diet's a big factor, and in the management of the diet. So you know, anything we do to manage acidosis, control acidosis, is effective in terms of preventing liver abscesses. You know, roughage level and type is important. If you have enough effective fiber, that buffers the pH in the rumen. It keeps the rumen wall, you know, that tactile stimulation stimulates the rumen. Having a good, healthy rumen wall can help prevent liver abscesses. So that's one factor. Another factor is the level of grain and the amount of grain processing.
Oh, sure.
You know, as we go from whole corn to dry rolled corn to finely ground corn, we'll see a more rapid decrease in rumen pH, which contributes to more potential liver abscesses. In addition to that, you know, some regions feed a lot more steam flake corn. And, you know, while that improves feed conversion significantly, it also contributes to the likelihood of more liver abscesses.
Yeah, and I think you hit on some good topics. It's roughage level and source. It's
Right.
grain level and processing.
And feed bunk management.
Absolutely.
You know, not only is it the diet itself, but it's how you manage that diet in terms of trying to keep a consistent feed intake. And so having a good program relative to feed bunk management is critically important.
Yeah. So and the relative importance of that feed bunk management is amplified as you decrease roughage and increase processed grain in the diet.
100%. You know, you can, like you say, you can feed a low risk diet, but if it's fed in a way that those cattle are going to have cyclical intake, they're going to feast and famine, you can create acidosis, and that can contribute to liver abscesses.
Yeah, and I would concur that when I see acidosis issues, it's generally weather,
Yeah.
feed delivery, some of these types
Right.
of things that we haven't put a windbreak up, and you wouldn't think that a windbreak would affect acidosis or liver abscesses, but if those cattle go bunch, get really hungry, and the more aggressive ones charge the bunk, here we go.
No question. Anything that you can do to keep a consistent daily intake, and you know, their environment's important. It's you know, keeping the cattle comfortable, dry, and during muddy periods that we happen to have a few from time to time here in Iowa. All of that contributes to that. But you know, some systematic management program to try to keep that intake consistent through feed bunk management is one approach.
And I think that you've the one that said what we have on paper versus what we put in what we buy as commodities, and what we put in the mixer and what we put in the bunk.
Yeah, the 4 rations.
Yeah.
The one that's formulated, the one that goes into the mixer wagon, and what's actually delivered to the cattle, and then what they eat.
You know, it's great information. When we come back, we're going to talk about some feed additives to help prevent liver abscesses. You're watching DocTalk, and we're glad you joined us.
It's the drive, the passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every hour in between spent grooming the next generation of champions. We're with you through the best times and the tough times. Seeing your horses through inevitable health scares and setbacks you never saw coming. Everything they deserve is here, delivered fast. We'll work hard for you so you can work hard for your dreams.
We are a start-to-finish yard. Bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. Heard all sorts of stuff about the generics coming out from, you know, a few different companies here and there, but we started working with Bimeda. What I like about working with Bimeda is our rep. You know, he seems like he's just one of us. He knows, he's been in the cattle feeding industry for a long time. He understands where we're coming from, what goes on in the feed yard. So we started implementing Rumensin last July, and we're using it as our first pole treatment. The data shows that the success rates on BRD, you know, they're equivalent to the other macrolides that we were using. You know, we just feel fortunate enough, I guess, to get our hands on it, and it works great for us for a, you know, first pole treatment. It's what really jumped out to us working with Bimeda, meeting with the rep. Rumensin's affordable. We finally got a product that everybody can afford. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. You know, that's something we really focus on, but when you've got a product like a Rumensin, it's just another assurance, protecting you, controlling your BRD from what stressors are thrown out there or what Mother Nature is going to bring to you. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part and we expect them to do their jobs, but also we expect, you know, the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proven that they're doing the job for us.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm here with Dr. Dan Loy. I'm Dr. Dan Thomson. We're at Iowa State University in the Department of Animal Science, where a lot of ruminant nutrition firsts and physiology and reproduction and genetics, just a lot of history here.
A lot of history here. You know, in our area, the ruminant nutrition, Dr. Wise Burrows, you know, he's probably most famous for bringing the first growth promotant to the beef industry. At that time, it was stilbestrol. But beyond that, you know, he developed the metabolizable protein system. He did some of the first in vitro evaluations of feedstuff. So a lot of pioneering work.
It's great. And so Dr. Loy is the director of the Iowa Beef Center, and he's a professor here in ruminant nutrition and physiology. Let's talk about some of the feed additives. You know, there's ionophores and there's antibiotics, but for the most part, Rumensin and Tylan are what were used.
Right. Well, let's talk about the ionophores first.
Yep.
You know, the last segment we talked about diet and managing feed bunk management and that type of thing. The ionophores, like Rumensin, for example, they change the feeding behavior of the animals, and so they eat more frequent, smaller meals. And when we talked about rumen pH, that, you know, then the pH doesn't drop as far and as quickly. And so they do, you know, they help control acidosis, help control bloat, and all of that can be translated to reduced liver abscesses.
I go back to that paper that Rick Stock did, where he looked at the CVs of intakes on Rumensin versus non-Rumensin, and we just have a lot more up and down without it.
We do. So that's one tool in the toolbox. I mean, the feed additive that is, you know, kind of the standard that's actually fed just for reducing liver abscesses is Tylan.
Yep.
And Tylan will reduce liver abscesses 50 to 70%. And so a lot of the industry where liver abscesses are likely to occur or of higher risk, that will be kind of the standard that they'll use to reduce the incidence.
Yep, and we'll feed Tylan at 8 to 10 grams per ton, or 60 to 90 milligrams per head per day to reduce that. And I can tell you that when we've done, when we look at natural cattle, when people try to feed cattle the same roughage and same processed grain in a steer that's not fed Rumensin or Tylan, we can have some deleterious effects.
We can have some very high incidence of liver abscesses in that case. Unless we manage, change our grain processing or feed higher levels of roughage and try to manage that acidosis in other ways, that can continue to be a problem. And antibiotics are under scrutiny, so there's a lot of research-wise for alternatives right now among universities and companies, and so that's kind of the search that's going on among a lot of people right now.
And I'll just put a plug in. We did research on different liver abscess vaccines, and really we haven't found one that can break through and protect like what we're talking about.
No, but a lot of research effort going on right now, but to this date, the most effective strategy is low daily feeding of antibiotics.
Yep. So if we want to prevent them, roughage, grain processing, consistent intakes, and then we have our tools such as Rumensin and Tylan that help us with profitability and things to that nature as well.
That's exactly right.
Yep. Well, appreciate you taking time out and being on the show.
Yeah, happy to be here.
Folks, thanks for watching DocTalk. Remember, if you want to know more about what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian and nutritionist. With Dr. Dan Loy, I'm Dr. Dan Thomson, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Valley Vet Supply sees the hard work and effort of you and your animals to achieve your goal of being a champion. And we're here to help along the way. To the cowboys and cowgirls, to the dreamers, we see you.